The honourable member for Bowman.
Deputy Speaker, this very important debate, brought to this chamber by the efforts of the members for Marinara and Leichhardt, is an issue that has been turned as a blind eye by the government over the last 3 years. And obviously we have a maldistribution of doctors in this country as we do a health workforce, and we need a solution rather than internal bickering between the government benches on whether there should be a point of order or not. Let's focus on the patients and the 1,800 doctors that we need in rural areas that are not there at the moment. And I should declare a conflict of interest in that I am a member of one of the aforementioned colleges. But there is no doubt that those colleges have to put their hand up, as has been pointed out, and take responsibility for distribution of health workforce. I mean, you can't be the nation's only specialist college and not take an individual, responsible position on equitable provision throughout Australia. Patients of different clinical severity can walk into a health establishment and be triaged on need, and yet geographically, when we triage this nation on need, there is no one doing anything more than the standard Rudd-Gillard government model of trickle-down economics, where if we turn the taps on and train a few more GPs, then hopefully one day they'll find their way out to rural areas. That is insufficient.
The honourable member resume his seat. Honourable member for Shortland on a point of order.
Yes, Mr Deputy Speaker. My point of order relates to the relevance of the contribution of the member on the other side. He isn't addressing the substance of this motion, and as such I would like to ask you if you could bring him back to the issue at hand.
Okay. The honourable member will resume his seat. The honourable member will address the motion before the chair.
That 20-second interruption was worth the effort, because patients in rural Australia will pay the price for that silly stunt. Deputy Speaker, the key issue here is getting rural workforce out to central and remote and rural Australia, and what we need are state, Labor, health bureaucracies working with the colleges, not against them, and that is what we saw in Cairns. Now, I do not want to comment on individual cases when I don't know all of the facts, but I do know one thing. The pesties were introduced as a preclinical assessment and an interview, not to pass and fail doctors, not to guillotine their health careers in this country after they've given up lives and workforces and careers overseas to come and serve Australia in some of the toughest and most high-need areas. It was to assess if they move from areas of certain risk to areas of high risk, from areas of where they might be working in a hospital to working more independently as a GP. That should be the question. And I think it's only fair that members on this side of the chamber ask the question of these pesties. Have they been adequately evaluated? Are they targeting the doctors that genuinely have clinical threats to rural and remote Australia, or are they being used for some other purpose? Now, what we don't want to see is a situation where state bureaucracies can say, sorry, no job here, and then you can have a clinical college saying, well, if there's no job, we can't help you, sir. We want their heads butted together to find solutions and not be antagonistic. Now, look, I want to say something quite simple, and that is that if you want to be the only specialist college in the country, you have a service obligation to make sure this nation is adequately provided with those doctors, specialists or allied health practitioners. That's not a big request. And we want to know that if people do come around the world to serve in Australia, that it's done fairly. They don't need a mountain of bureaucracy for the sake of bureaucracy. It's one thing to create a single registration board for the nation, but quite another to use pesties as a way of further interfering with clinical provision. Now, without saying that in any individual cases occurring, I'd like to know that these pesties are being fairly and adequately evaluated. Look, in this great battle of assessing overseas qualifications, Deputy Speaker, we've always found it very difficult to evaluate medical schools according to the level of quality of their graduates. Yet I know Australian universities do that all the time. They will only accept Indian graduates from Tier 1 and Tier 2 Indian universities to study at selected universities. We don't do the same thing with doctors, and that we pay an enormous price because we put through English-trained GPs from high-quality institutions through a complete rigmarole that is utterly unnecessary and serves only to damage health provision in remote areas. I believe if you are trained in an English-speaking university, there is no need to tie these graduates up who arrive here to test them in their levels of English. If we're going to do an IELTS test, put them to clinical supervised work if they have an IELTS of 6 and let them show that they have adequate English because they're working with a supervisor. Why not get them to work? Don't use the pesky as a way of interfering with that. I'd like to see stalemates like we've seen in Cairns resolved rapidly. I'd like to see Pesky's adequately evaluated. They were never meant to be pass-fail. They were meant to be indicative and to be drawing attention to areas where clinical skills were inadequate, and that's what we need to move towards, an area where the administration is no longer used as a way of putting brakes on clinicians, but it's used as a way of identifying those who can practice safely in the bush.